Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will teach you about hand-foot syndrome. Don't get confused with hand-foot-mouth disease. That is a different disease, okay? This is hand-foot syndrome. Hand-foot syndrome, okay? Now hand-foot syndrome is also known as dactylitis. What do you mean by dactylitis? Because here we can get inflammation of the fingers, inflammation of the toes. So this is known as dactylitis. What happens basically in hand-foot syndrome? This happens in the sickle cell disease. It happens in sickle cell disease. And remember, this is often the first symptom of sickle cell disease in babies. This is the first symptom of sickle cell disease in babies. Basically what happened? The sickle shape RBC that gets stuck, that gets blocked in the blood circulation. It causes blocked blood circulation, and basically it causes tenderness, swelling, and that is known as hand-foot syndrome or dactylitis. So what is dactylitis? Dactylitis is the first symptom of sickle cell disease in babies, which cause severe pain, and it affects the bones of hands, feet, or both. And what is the symptoms? The symptom is pain and tenderness along with swelling. Pain and tenderness along with swelling. So there was an MCQ regarding the hand-foot syndrome or the dactylitis. It can be found in which disease? Sickle cell disease. Remember, dactylitis or hand-foot syndrome is found in which disease? Sickle cell disease. And why this is caused? There was another MCQ. Hand-foot syndrome is caused due to blocked blood circulation. Blocked blood circulation by which cell? By the sickle shaped RBC. By the sickle shaped RBC. It causes blockage, and this causes tenderness, swelling, and extreme pain, severe pain. So look at the picture how the swelling can be noted in the dactyls and also in the feet. You can see. So it can be found in babies in sickle cell disease. Now look at this slide. Dactylitis, which is hand-foot syndrome. It is painful swelling in the hands and feet, usually the first symptom of SCD, sickle cell disease, in infants and toddlers. This swelling often along with a fever. Now this dactylitis, hand-foot syndrome, this occurs along with a fever. And how it is caused, I already told you. Sickled cell, they generally get stuck in the blood vessels, and this block the blood vessels in the smaller bones of the hands and feet, and it caused dactylitis and hand-foot syndrome. Now you must also understand there is another hand-foot syndrome. Okay, there is another hand-foot syndrome. This is known as Palmar-Plantar erythrodysesthesia. Palmar-Plantar. Palmar, it occurs in the palms of the hand. Plantar, and also in the plantar region. Erythrodysesthesia. Remember the term erythrodysesthesia. It is basically why this occurs? Because of the side effect of some chemotherapy drug. Basically what happens, these patients are having cancer. These patients are having cancer and they are taking chemotherapy, and some particular chemotherapy drugs, they causes redness, they causes swelling, they cause blistering of the palms of the hands and also on the soles of the feet. So both on the palmar region and plantar region, both this palm and plantar, both on this blistering and redness occur. That is also known as hand-foot syndrome. But this hand-foot syndrome is due to chemotherapy drugs. Remember, this hand-foot syndrome is due to some chemotherapy drugs. It is a side effect of chemotherapy drug. So remember, it may also come in this way. They may give you a picture and they may ask you this hand-foot syndrome, which is also known as DASH, which is also known as palmar plantar erythrodysesthesia. It is a side effect of chemotherapy drugs. Another question, hand-foot syndrome, which is a side effect of chemotherapy drugs, it causes DASH. It causes redness, swelling, blistering on palms and soles. So remember, this is another hand-foot syndrome. It is not the same hand-foot syndrome as we can found in the SCD, as we can found in the sickle cell disease. Sickle cell disease in the babies, in the infant, in the toddlers, we can found the hand-foot syndrome. That is different hand-foot syndrome. And this is another hand-foot syndrome, which is palmar plantar erythrodysesthesia, which is the side effect of some chemotherapy drug. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel is for helping the MBBS students and those students who are preparing for PG entrance. Thank you. Have a nice day.